What's up, guys? Chapter 9. Okay, make sure you have your notes out. I will have my notes out. Will you? All right, I'm gonna bring it over here, and I'm going to be quick with this video. Okay, your head. Okay, divided up into different areas by suture lines. Okay, you have 28 bones in your skull, and your mandible is the only movable bone in your skull. Why? You got to chew, right? It has teeth there. Okay, their brain has four lobes: your occipital, parietal, frontal, and temporal. Your temporal being the most vulnerable due to most vulnerable to injury due to its softness of the sides, as you can touch just gently on the sides of your head. And of course, your occipital lobe responsible for your vision, which we could go on over to the next aspect of it as far as what the lobes of the brain are responsible for. Your cerebellum, responsible for equilibrium, which is your balance and just specific reflexes that go on throughout the body. And of course, your spinal cord is right below it. Your frontal lobe is responsible for a good number of voluntary movement, especially with the eyes. And your temporal is responsible for hearing and speech. I like to use this example because I think of the police chief from Bad Boys that anytime he would get pissed off, he would just rub his temples because your temporal lobes also regulate emotion. Okay, you do need some hair on your scalp. Okay, it is very beneficial, as one of the questions from your notes. Very beneficial to have hair on your scalp. While your scalp, as far as skin is concerned, and your skull, it can take some pressure, but just imagine the amount of pressure that your scalp can take with hair on it. So it is extremely vascularized, meaning that there is a number of veins that can be seen from your scalp. And that's the other reason why hair is also important to protect those blood vessels that are located in your scalp. Now, the reason why it's so important to protect your head, as you can see in this picture, this gentleman has used his head as a weapon. So there are a number of rules and regulations that are in almost every sport to prevent that. But additionally, helmets and mouth guards are critical to preventing head injuries. And of course, you want to make sure that you're kind of keeping a cool head. Don't be ejected from the game so you won't try to headbutt anybody. All right. So the reason for majority of the injuries that happen in the head is all related to, as far as kind of a quick motion or a quick rotation of the head, as an action. Specifically, think about counter coups, where basically your head is moving while it's hit. Okay, and oftentimes the brain will move across the skull. Now, going back up, you just want to think about the brain itself. Okay, it's about a 3 pound, it's basically about 3 pounds inside the skull, and it's housed within cerebrospinal fluid. Now, your cerebrospinal fluid is critical for the protection of, just kind of like a small bump in the head, or, maybe a quick jolt in the car as you hit the brakes. But however, anytime it's a kind of a direct impact, sometimes your cerebrospinal fluid does not always protect that. So it's always important to orient yourself with the areas that are most vulnerable to injury, which, as I mentioned before, your temporal region or your temporal lobe is highly susceptible to injury or the impact of injury. With skull fractures, you want to make sure that you seek medical attention as quickly as possible. You have battle signs, which is basically discoloration or any type of bruising behind the ear, and consciousness. That athlete might lose consciousness. So it's very important for the athlete to seek medical attention for a fractured skull to prevent bleeding, which could then place injury onto the brain. Okay, I'm pretty sure you heard of this. A concussion. The most common side effect of a concussion is confusion, but nausea, headache, dizziness, vomiting, difficulty speaking, tinnitus, loss of balance. Um, those are additional symptoms and signs of a concussion. Hence why if you are working with an athlete or maybe working with someone who may have bumped their head, especially against something that is heavy or maybe on impact, and you definitely want to talk to them to understand what's going on. Do they have any symptoms? To see, kind of see if there's loss of consciousness. Of course, you'll know if it's loss of consciousness there, but it's very important to understand these symptoms because you don't want to immediately involve your athlete back in that sport again, especially if concussion is present or a concussion has been diagnosed. But there are general statements that certain credentialing boards have made in reference to um, head injuries and concussions, one of them being the National Association of Athletic Trainers and the other being the American Academy of Neurology. There are 3 grades to grading your concussion. You have mild and moderate, being in more common cases, just being the differences being in time. But severe is just loss of consciousness, and it is a medical emergency. But that does answer one of your questions on your sheet. How many grades are there? With concussions, it's a strategic plan to get the athlete back into the sport. So they have to be cleared that by a physician, a doctor of osteopathic medicine. Did I say that right? Osteopathic. It's late. I don't even know. But any and your medical doctor, your nurse practitioner, those are the people that you would need to get involved as far as clearing the athlete for a return to sport. Yes, I did say it right. Osteopathic. It's been a long day of recording, so I had to make sure I said that right. Okay. Moving on, you have your intracranial hematoma. Okay, that is bleeding on the brain. All right, and it's so important for medical attention to be sought for this because accumulation of blood on the brain can cause death. Okay, and symptoms can include nausea, vomiting, loss of consciousness, paralysis, battle signs in the areas of behind the ear. So, post-concussive syndrome. Basically, it's the continuous, ongoing impact of concussions that go into activities of daily living. And of course, there's headaches and tinnitus and dizziness and confusion. And second, impact syndrome. So when one gets multiple concussions in a short period of time, either way, it is so important for you to assess the athlete to ensure that they're able to return to the sport to avoid this case, a chronic traumatic encephalopathy, which Aaron Hernandez was noted to be the most severe case of it. The only way to diagnose someone for CTE is if they are deceased, and of course an autopsy is performed, and they have linked the studies of brain damage from CTE to behavioral changes like suicidal ideation, balance, aggressiveness, loss of memory. As a result of that, it just really breaks the brain down. And hence why it's so important for younger athletes to be prepared and making sure that they're wearing the right gear that protects them from concussions. Generally, as we know, the story of Aaron Hernandez. So I encourage you to look him up, look a little deeper into his story. Maybe you want to catch a story on Netflix. Yeah, if you have any questions, let me know. But that wraps up chapter 9.